good to see you again, Mr. Jones. How have you been?
I have an issue that I didn't mention when my nephew was here because I didn't feel comfortable.
I'm your doctor. You should feel comfortable. You can discuss anything with me.
Well, it's probably the biggest thing that's keeping me from deciding to start HIV meds.
Okay.
I use heroin occasionally.
Okay. I can understand your concern because if you're considering starting medications to treat your HIV and you're currently using heroin, it could present a problem. It can make the picture a little bit more complicated.
Substance use can be an issue with taking HIV medications. One of the big issues is that if someone spends most of their time thinking about getting the drug, using the drug, recovering from using the drug, then they really don't have that much time to worry about taking their HIV medications as they're supposed to. The other thing that could be an issue is that some of the lifestyle problems that come with using substances. You may not be living in a home regularly. You may be staying in other people's places. Those things can make it more difficult for you to take your HIV medication as you should. Does it mean that using substances automatically means that you cannot take HIV medication? No, it doesn't. And it's important to talk to your provider about your lifestyle so that you can figure out if there's anything that's going on that could make it difficult for you to take HIV medication.
Have you thought about treatment, or have you ever been in treatment before?
I tried methadone, and actually I was off of it for about a year, but then my best friend died and, well, sort of fell back into it.
If it was possible for me to contact someone, would you consider a treatment program again?
Yeah, kind of.
Okay. Would you consider psychotherapy?
Why would I need that?
Well, it'll give you an opportunity to sit down with someone and discuss, what are some of the reasons why you relapsed and you went back to using the drugs, and also help you make things more clear for you as far as some decisions that you might want to make regarding treatment.
A lot of people choose to change up how they use their substances. Some people use less often, or they choose to only use at certain times of the week. They may not use every day anymore. They may only use on the weekends. They may use less often. Some people decide to go into detox and try to get off of the substances that they're taking. But everybody is different, and you need to speak with your provider about what's the right step for you to take at this time.
We can talk in more detail once we decide which HIV medications is right for you. Mr. Jones, I realize today what you shared with me was very difficult, but I think that it's a step in the right direction. And I think that with the options that we were presented with today, a drug treatment program, such as the methadone program, and or psychotherapy, I think that we can move forward and address some of the issues that you've expressed with me today. I'll make some phone calls when you're ready. You'll let me know, okay? And we'll move forward from there. And I look forward to seeing you again. Is there any questions you have for me or any concerns?
Well, you've given me a lot to think about, but thank you. I feel much better.
Feel free to call me. I'm here for you.
Well, thank you, Doctor.
Okay, thank you. Give you a hug.
Most substances affect your immune system. Pretty much all of them do. And having your immune system affected anyway can make you sicker. Some of the substances, depending on what they are, can also have some interference with the HIV medication. It may make the side effects of the HIV medication more intense. It could make it difficult for the HIV medication to actually work in your body, so you don't get the viral load dropping that you thought you would have because of the substances that you're using. Some other things that can happen is that sometimes the HIV medications affect the response that your body has to the substances that you're using. So it's really important to be honest with your provider about what you're taking, because that could mean that the provider will look at different medications that will work better with you. Alcohol can be an issue with taking antiretrovirals or HIV medications because alcohol reduces your immune system anyway. If you're adherent to the medications and you're also drinking, the medications may not work as well in your body. And that's because a lot of HIV medications and alcohol are all taken care of by your liver, and your liver gets overloaded. If you have a history of hepatitis B or hepatitis C, that's going to make it even more difficult for your liver to do its job. So again, the medications aren't going to work as well, and you may have some liver problems. If you have a drink once in a while with dinner, a couple of drinks with friends on the weekend, that's okay. We're just talking about someone who's using alcohol all the time in excessive amounts, binge drinking, that's when it becomes a problem for the medications as well as for the liver. A lot of people smoke cigarettes, and we know that smoking cigarettes can interfere with some of the HIV medications and how well they'll work in someone's body. We also know that smoking is going to affect your lungs and put you at greater risk for pneumonia, bronchitis. Again, it's one of those things that you want to be upfront with your provider about smoking, if that's what you do, how often you smoke, and also be prepared. The provider is going to talk to you about maybe cutting that down and looking at maybe stopping. There are patches that you can use, and that's not a problem if you're taking HIV medications, if you want to do the nicotine patches. But that's a conversation to have with your provider. Using cocaine or crack it does affect your immune system, so it will, any effect that you have with the medications, the HIV medications, there won't be an interaction between them, but it's almost like you're crossing out the benefit of taking those HIV medications regularly if you can do that and take cocaine at the same time. And it could cause more problems with other parts of your body. We know that cocaine can do a lot of damage to your heart muscle, and if the HIV medication, it's a possibility it could increase the damage to the heart muscle. So you want to be really careful about cocaine use with HIV medications. Marijuana is a substance that many people with HIV have used over the years. They've used it to control nauseousness. They've used it to increase their appetite. The evidence that we have does not show that there's any interaction or effect of marijuana on HIV or HIV medications. As a matter of fact, the main substance, the main part of marijuana is used as a medication to treat nauseousness and lack of appetite. Whatever substances someone is taking, whether they be street drugs or prescription drugs that belong to someone else, or herbal medications, it's very important to let the provider know, because there could be interactions between those substances and the HIV medications, and the provider may want to change which medications are being used, or maybe even the dosing. So it is very important to have that conversation with your provider.